Lung cancer has historically been more prevalent in men than in women. This gender disparity is associated with differences in smoking patterns between men and women, as cigarette smoking is a major risk factor for lung cancer. However, the landscape of lung cancer incidence has been evolving and the gap between men and women is narrowing.
It has been since 1900 century that the lung cancer is traditionally more in males just because there was more incidence of smoking in them. So smoking related lung cancers were the lung cancers that used to happen 100 years back, and over the last 100 years other types of lung cancers have developed, like adenocarcinoma of lung, which has started to develop even in females now. Two causative factors could be: one is that the females also have started smoking, and second, in never smoker females also these cancers are now happening.
Lung cancer symptoms can vary between individuals, but is there any strict division based on gender too?
Usually not. The types of lung cancer could be slightly different in women, but symptoms are usually the same: cough, breathlessness, there is bleeding in the cough. Those could be the symptoms. Those are there in both men and women. The type of lung cancer could be slightly different. Men could have more chances of having squamous or a small cell lung cancer, which are more associated with smoking, and female can have more types of adenocarcinomas.
So are the treatment approaches for lung cancer gender specific? As experts say that the choice of treatment is primarily determined by the type and stage of lung cancer, the overall health of the patient, and individual considerations.
In the last 10 years, the lung cancer treatment has dramatically changed, and this paradigm shift is because of the newer treatment options like targeted therapy and immunotherapy. And these immunotherapy and targeted therapy work differently in different lung cancers, and that is why we have to select these lung cancers properly for different tumor subtypes for these therapies to act. So we have to do a test called molecular test for these lung cancers, and that defines what are the findings in those tumors that are leading to that cancer, right? So we identify the cause, that this particular mutation has caused this cancer, and we can target them with either a targeted therapy or an immunotherapy. So how these are different is these targets which are positive are more positive in females. So females who are never smokers will have a lot of targeted therapies that can be given, which can include an oral targeted therapy which may cost you around 2,000 rupees a month and can keep you well even in stage 4 lung cancer for 2 to 3 years, 4 years also. So those targetable mutations are more common in females. However, if you see immunotherapy, with respect to immunotherapy, males who are smokers or females who have smoking related cancers may have more of immune responsive tumors, and they can use immunotherapy in them. So treating cancers is males and females is just we are corroborating with the mutations, but mainly it is how we treat is based on the mutations that we find. We should quit smoking, and quit smoking specifically in public places, because the in public places second-hand smoke can cause cancers in people who are not smoking directly, right? So at least in public places it should not be done.